Okay, Dr. Raman, what is endometriosis?
Endometriosis is a very enigmatic disease. Basically, every month when a woman menstruates, the lining of the womb sheds. In this case, the lining of the womb has gone outside the uterus and deposited in many parts of the body, and it then grows in these areas of the body. That is endometriosis. The presence of endometrial tissue outside the body of the uterus.
Okay, Dr. Raman, what do you think are the possible causes of endometriosis?
Again, nobody really knows the actual cause. There are many theories which have been propounded. There are strengths and weaknesses of each of these theories, and therefore no one true theory holds true. In scientific evidence up to today, if you look at the evidence, nobody really knows why endometriosis occurs. But we know there are certain predisposing factors. Genetics, for example. Mother had endometriosis, the child, a female child may develop endometriosis. History of not having children. History of having very few children. So these are some of the factors that lead to endometriosis, and of course, in some of the women who are infertile, they do present with endometriosis. So actual cause unknown, a lot of theories.
Dr. Raman, what about the symptoms? How can we know we have endometriosis, and how do some females know that they don't have endometriosis?
Symptoms are non-specific because they can occur in other gynecological conditions as well. So some of the symptoms like pain and menstrual pain are not peculiar only to endometriosis, but if it's persistent and getting worse, especially when the period is over, it should lead you to suspect endometriosis. Deep pain during sexual intercourse is another common symptom. Rectal bleeding and rectal discomfort after passing motion is another reason to suspect endometriosis. And of course, sometimes when you are infertile and you go for a scan, you may incidentally discover a cyst which turns out to be endometriosis. So painful periods are the main issue, and if it persists even in a young girl, it should lead to a suspicion and should be investigated.
Okay, Dr. Raman, what about some patients? Some of them, they think or suspect they have endometriosis, but doctors tell them otherwise. So could it be that it cannot be identified through ultrasound? Is it possible for that to happen?
Certainly, because there are many grades of endometriosis. Using the most common grading system, which is the American Reproductive Medicine grading system, which divides from stage 1 to stage 4. In early stage disease, you will see nothing, even on MRI, on CT, or by ultrasound. But as the grade gets worse, you may actually see evidence of cysts or masses either in the uterine wall or outside the uterus. So yes, the answer, in mild stages of endometriosis, you may not see it. Even a laparoscopy, which is the gold standard, sometimes you may not be able to see. So even if you don't see endometriosis on laparoscopy, it doesn't mean you don't have endometriosis, which may be deep inside at the back of the uterus attached to the large intestine. But you may have endometriosis. So therefore, if you see it, a tissue, you have to biopsy it and prove it under the microscope histologically. This is endometriosis. That's the gold standard. So yes, early stages you may not detect it. In late stages, yes, you may detect it.
Okay, Dr. Raman, this is just a question that I get all the time, from females around. Some of them, they were diagnosed as having mild stage of endometriosis, but they experience really horrible pain. And then there are females who are diagnosed with a very later stage, and then they experience no pain. So how is that possible, Dr. Raman?
That's well known. the amount or the type of endometriosis does not correlate to the degree of pain. In the recent understanding of pain in endometriosis, which is another issue altogether, what has been found is that these women actually with endometriosis have got new nerve endings that have developed, and they are very sensitive. And this is similar to irritable bowel syndrome. In fact, endometriosis and irritable bowel syndrome coexist. So we don't know what is the cause of pain. The other is the toxic substances produced when they menstruate in the abdomen. They produce all sorts of agents which actually create pain. So even though there are mild dots, if these substances which produce pain occur, they have severe pain. But they may have a large cyst or a mass which doesn't produce a substance, may not have pain. Or they may not have too much of new nerve endings. So the more nerve endings you have, the higher your sensitivity of pain. And this has been recently described from the Sydney group.
Okay, Dr. Raman, another question. What about adhesions and lesions? How does that affect pain for females with endometriosis?
Adhesions in general can occur from surgery or infection. And what happens in adhesions is that if it is intestine, the intestine gets stuck, or the tube gets stuck, or the uterus gets stuck. So when these organs get stuck, like the intestine, the food has to go through the intestine, and that is impaired. And when that is impaired, it gets partially blocked, it gets distended, and you get pain. So not all adhesions get pain. There are people, a lot of adhesions who have no pain. There are people with mild adhesions who have pain. Again, is it due to adhesions or due to something else? So not all adhesions give rise to pain. So I won't blame adhesions as such, but they can give rise to pain, but not in all cases. Certainly irritable bowel syndrome is one cause where there are no adhesions but severe pain. So the mechanisms of pain vary.